we're very lucky again to have Dr. Natasha back on board with us. You guys may have seen Dr. Natasha last year and the year before doing her talk on core medical training in the UK. So it's really, really great to see her back on board again. And Natasha is now a third year, I believe,
Yes, yeah.
core medical trainee. Yeah, with a last I knew, aimed to be a respiratory consultant. So I presume that hasn't changed in the last 12 months or so.
Yeah, it hasn't.
Good, good. But no, super, super to see her on board again. Awesome. But yeah, really, really important topic. Core medical training is an area that a lot of junior doctors plan for before even PLAB days. They think about whether they want to be a respiratory consultant, a cardiologist, a GI consultant, all come under this bracket. So whether it's dermatology, infectious disease, sexual health, this is the specialty that you need to be applying for. So it's a big one. We'll hand it over to you, Dr. Natasha.
So I'm currently working as an internal medicine trainee in year 3 at Nottingham University Hospital. So there we have got 2 hospitals. It's Nottingham City Hospital and Queen's Medical Center. So we tend to rotate in both. So respiratory medicine is at City Hospital. So when I'm doing resp, I'm at City. When I'm covering on-calls or admissions or acute take, at that time I'm working at Queen's Medical Center. So I just want to get rid of, yeah, okay, that's fine now. Okay, so a little bit about myself. Well, I have had this talk a couple of times before, and if you have seen those talks, you might know a few bits and pieces about myself. I've graduated from Pakistan Sindh Medical College, Karachi in 2016. I completed my house job from Jinnah Hospital, Karachi in 2017. And then I started working in a cardiology-based hospital. I worked there for 1 year. And while working there, I took all the exams, IELTS, PLAB Part 1, PLAB 2. Then I got my GMC registration on 15th of June 2019. And then I started applying for all the jobs which were available at that time. Like I think I applied around 300 jobs. And I got interview within a week time. I got 3 interviews. I took all of them and I started working in Pool Hospital in September 2019. So it's been around more than 4 years now. So my first job was in Pool Hospital, which was basically a medical job. I was rotating like all F1s and F2s. They do rotate here, and that was the best part of my job. Especially the hospital itself was very good, and I think it was mainly because it was a district general hospital, and I think it's the best thing to do is to start working from a small district general hospital. And always, I know there's a lot of competition these days, and it's difficult to get jobs, but try and get a job in the specialty you want to do later on. Then I started my IMT year 1 in 2021. So my first year was in Pilgrim Hospital, it's in Boston. And then I started year 2 and currently in year 3 in Nottingham University Hospital. So this was a little bit about my background. So we will talk about the internal medicine training and how you can enter into internal medicine training. But before that, I will talk a little bit about what internal medicine training is, because it's very, very important for anyone who is applying into any training program, not only internal medicine training, is to know what that training program is like and what you would be doing, because it's better to know what you're going to do rather than getting into a training program and then leaving it because it's not meeting your expectations. It's just a waste of time and your hard work. Internal medicine training is basically a training to become a medical consultant in the UK. So it has 3 years. So year 1 and 2 is basically the years when you'll be having 3 rotations in 1 year, and you'll be rotating in all the medical specialties, including 4 months of intensive care and 4 months of elderly medicine. Apart from that, you'll be rotating in cardiology, gastro, endo, respiratory, like that. IMT year 3 is where you would be expected to become a medical registrar. So you'd be expected to work like a medical registrar. It's not you tagged as IMT 3, but you will be a medical registrar. You will be on the medical registrar's rota, which I didn't know, but now I know because I'm doing it. So And for the 6 months, you will be in one of the specialties you got. It could be something that you want to do, like I want to do RESP, and I luckily got RESP, but then it's not always the case. Then for this, the other 6 months, you'll be in an acute medical ward where all the admissions which are coming from ED or GP or like acute admissions are admitted, and then you have to manage them, and then you'll be assessed based on how well you can manage a acute unselected day. During these 3 years or before, you have to take MRCP. It has got 3 parts: part 1, 2, and PACES. Also, you have to maintain a portfolio, which is the major criteria for yourself to get signed off and complete your IMT 3. Apart from exams are important, but maintaining and meeting the competencies is more important. And you maintain your portfolio on a JRCPTB website. You can always visit this site to have a more idea of what you'd be expected to do during this time. So a little bit about pathway to UK. I know this has been discussed many times. You take IELTS, OET, PLAB 1. So PLAB 1, I have recently got some idea because my sister took this exam, and I can see that there's a lot of competition, and so many people applying for this exam. So you have to be really well prepared. But not only PLAB 1, PLAB 2, because PLAB 2 again, because there's so many people. There are like I think 10 times more or 20 times more doctors applying for PLAB as compared to what it was, I think 4 or 5 years ago, or even more before. So you have to be really well prepared for this. And the main thing I'm talking about PLAB 2 is only because I want to emphasize on the fact that I see so many questions about what academy to choose, what institute to go. So you need to, this is a very important decision. So you have to make this decision considering yourself. So if you are like someone, you're someone like me, like how I used to be like a very shy and introvert person, couldn't speak, and I chose an academy where there were like 110 doctors, and I was never like even noticed. So you need to choose an academy where you are assessed based on your performance, because the last thing you would want is to take the exam, and when you are stepping out of the GMC building, at that time you know that what where you lack. So choose an academy where you can be assessed individually, and you are basically told where you need to improve. Then you get GMC registration. You join an NHS hospital, get some NHS experience. During that time, you get your CREST form signed. Make yourself ready for the interview and for the application. Is how you enter UK. Right. So the curriculum for the internal medicine training. So we're back on internal medicine training. So the curriculum is basically where you will be joining NHS is the foundation year training. You'll be in this category because this is foundation year training. Foundation training is for the F1s and F2s who are under the UK, who have graduated from the UK medical colleges. But for us, we will be F foundation trainees at the trust grade. And during this time, you'll be able to get your competency signed off. Then that is the CREST form. Then you will apply for internal medicine training. You will be doing 3 years of training. Then you'll be applying for the specialty training programs. And then that would be 4 or 5 years based on the specialty you choose. Okay, so how to apply for internal medicine training? So there's round 1. There's round 1, the application window would open in November. There's no round 2 now. It's been an old thing now. And you'll apply it through Oriel. So I'll be a little bit fast because I'm looking at the time we have. So we're running out of time. So I'll be a little bit fast because there's a lot of repetition from my previous talk. Group 1 and Group 2 specialties are the ones. If you go for Group 1 specialty, you'll be having 3 years of internal medicine training. If you're going for Group 2, your internal medicine training will be narrowed down to 2 years. So eligibility to apply for an IMT is the CREST form. So you need to get your CREST form signed off. And there's a lot of discussion about the CREST form in the past. And I'm sure most of you would be familiar, but we'll be we'll be having a talk a little bit about it. Sorry. So once you get your IELTS or ETGMC registration, you'll be working in the UK. So these will be automatically signed. You'll be automatically having all those things. Then you need ALS. So ALS you can easily get in once you're in the UK, but you have to get it before you apply. So the CREST form, these are the few areas of the CREST form where you need to work a little bit hard. Otherwise, the most of the CREST form, you can easily get yourself signed off if you have worked in the UK for about a year. So I have discussed this previously as well. So the procedures, you can get yourself signed off. If you want, you can go into an ED and get yourself signed, emergency department of your hospital, and get this done in a week. Then cardiac and respiratory arrest. So if you are working in a district general hospital or a tertiary hospital, you can ask the switchboard to issue you a bleep after discussing with your educational or clinical supervisor. And then whenever there is an arrest call, you would be receiving the bleep. And you can ask the medical registrar to allow you to lead at least one cycle, and you can get this done. These are some of the ideas which worked for me. So I'm just sharing them with you. I hope it works for you as well. Then quality improvement project, it's so easy to do, get it done in a week time. It depends on how much help you can get from your supervisor. But make sure you do a QIP, and when you apply, you'll get extra marks for this. Portfolio, you'll apply through Oriel. You will be filling out the Oriel form based on your little bit about your introduction, your achievements, a quality improvement project that you have done, and then you will be talking about it, so you'll get more marks. Leadership. So I know it's tricky to get a leadership role, but if you think about things that you can change, or for example, what I did was that where I was working, we do not have like the doctors, the trust grade, the new trust grade doctors, they were not on the on-call rota. So they were not really into the managing the acutely unwell sick patients, because they were not on the on-call rota. They were doing the ward jobs. So what we did was that we started a project where we were basically allowing, there's a whole program where we used to train our trust grade doctors on a SIMMEN to manage the acutely unwell and sick patients, and that gave them confidence. And this was the project which I led, so I was able to get marks for this one. Presentations. So if you do a QIP, you present it, you can get marks on QIP as well as presenting the QIP. And then MRCP, having it is a good thing, but if you don't have, don't worry, but it shows your commitment to medicine. Then this is a quick, I'm going to run through this very quickly, because this is the marks distribution, the scores that you can get yourself before you apply for the IMT. So if you have an undergraduate degree, you can get some scores on this. If you have got postgraduate degrees, you can get yourself some scores on this. If you have presented anything, any presentation, any posters, any research work, you can get yourself marks on this as well. And this can also be if you have done those things in your home country, like I did a few in Pakistan. So I was able to get marks on this if you show the proof. If you get an award or a certificate, you can show that and you can get marks for this. If you have been involved in teaching, I think it's a good idea to always get yourself involved in teaching. If you can teach F1s or medical students and get yourself some assessment forms filled by them, you can get marks. It's very, very easy to get them. Training in teaching, there's a teaching, I think it's from the Oxford Medical Education, Teach the Teachers. Yeah, so that course gives you, I think, 1 or 2 marks. So have a look at that. Then quality improvement project, like I said, it will give you marks. Leadership, I've talked about it. Publications, so if you have got any QIP or any case presentation, like if you have written a good case also, then you can, and it has got published, you can get marks for this. So this is the graphical representation of application score distribution in the year 2023. So it's the last year's one. And the reason why I've included is to show that if you see on the extreme left side, people who have scored, doctors have scored even like 2, 4, 6, 8 in the pre-interview application were shortlisted. So this is the benefit of having an interview. Because in my year, there was no interview and this wasn't the case. It was completely opposite. So I'm going to discuss a little bit about interview because interview has become so important. There's so many doctors who want to apply for internal medicine training, and half of them or less than half of them get shortlisted. And then after interview, it's always the very few, it's always like around 2,000, if I'm not wrong, 2,000 doctors who get into internal medicine training program, 2,000, 2,500 roughly. So interview format is approximately 25 minutes. So you have got 25 minutes to show them that you are competent enough to get into internal medicine training program, and you're competent to be seen as a future medical registrar or medical consultant. So you will be based on your application. You will be assessed on your application. You'll be assessed on your application, your ethical and professionalism and governance. And then you can get some idea about this from the GMC website of where they tell you about the good medical practice. So there are 3 questions in the interview. So the question 1 is basically about your application and your suitability for IMT. So section 1, they will be giving you a time for you to run through your application. So you can always take some notes, but it will be mainly yourself explaining what you have filled in the online application form. So after that, they will be asking you questions on that. Okay, then question 2 will be basically you'll be given a clinical case, and you'll be given 3 minutes to read that case, and then you'll be asked questions on the case. So, and then 1 minute for the handover. So what my message for everyone who is going for internal medicine training interview is to basically use those 3 minutes effectively, because it's always the case, even for PLAB 2 also. It's important to use the time that is given to you for reading the case, because you'll be able to read the case in a minute, isn't it? But then you have to properly understand the case and make some differentials and questions, make some differentials and some questions in your mind that you're going to ask those. And always make sure that you give especially in an IMT interview, I would want someone who is if you're a safe doctor, you should have some differentials in your mind rather than a clear diagnosis, because it's very difficult for someone at our stage to, I mean, sometimes it's very obvious and that what the diagnosis is, but still it's important to rule out the red flags. And I'm sure if you do that, you'll be getting very good marks if you rule out the red flags and you make sure that you're being safe. And then the 1 minute would be for the handover there, and that is also very important. I'll tell you later on what you can do with that. The question 3 will be an ethical case, like if you have taken PLAB 2 already, so you must be familiar what kind of ethical cases you can have in your exam, and you'll be given 5 minutes and you'll be assessed. Basically, if you look at these attributes, it's all what you have got in your CREST form, isn't it? So you get yourself signed off on your CREST form on all these attributes of a good doctor, and then you'll be asked to present yourself and to confirm that you've got those. Right, and then scoring framework. So read through the IMT recruitment website, scoring criteria, it's very, very important. And then when I was telling you about the handover, so it's the SBARTs. I think if you're working in NHS, you must be familiar with this, but it's so important to make your handover based on SBAR, which is the situation, background, assessment, and then recommendation. And it is important for you to have a look at this once you finish listening to my conversation. And the key to remember for the interview from my side is to be safe, be polite, be prepared for the interview, be clear with what you're talking, and be the best version of yourself. Because no matter how good of a doctor you are, how would the examiners, they would know? How would the person who's taking your interview, they would know? Because you have got only 25 minutes to prove it. So be the best version of yourself. This is the process in a nutshell. I have updated with the current dates. So the application window is going to open on 26th of October and will finish on 23rd of November. Long listing would be based on your pre-application score, so your application score, sorry, and shortlisting will be based on, long listing would be based on your, if you are meeting the eligibility criteria. Shortlisting would be based on your application scores. Then you'll be invited for the interview, and your interview, then you'll be able to book an interview. I think there are twice they'll be allowing you to book for your interview interview, and then interview will be between 2nd of January to 16th of February 2024. Then you'll get your rankings released on 27th of February. And then you'll be able to choose the program preference, like you'll be able to rank your preferences. So be very, I'd say, very vigilant and make sure that you're ranking your preferences correctly. And then you'll be getting the offers by 19th of March 2024. So I think that's it. If you have any questions, you can ask.
Yeah, it's really, really good actually. Someone saying at the end, thanks for sharing the slide on the nutshell process at the end, because it's quite neatly summarized, I think, for people to see. And there's lots of steps for all these things, and sometimes when you see it in graphical form, you can almost envision the endpoint. Sometimes when people just put it all in lists, it's quite challenging, and it seems quite a heavy process ahead of you. But once you see it like that, it's quite useful. So that was a really good slide, I think, at the end. Pooja, any key questions that you picked up? I know you've been answering a few as we've been going through. There's a couple of just asked very quickly before you do, Pooja, what's the difference between core medical training and internal medical training? And we kind of said that in terms of application, it's in essence the same thing, but these two terms often get confused, but they're exactly the same. So whether you're applying for core medical or internal medical training or medical training or general medical training, it's all the same at the beginning, I guess. It's later on where things start to specialize. But Pooja, go ahead.
So someone's asked, Natasha, to get into IMT, is it right that you only need to have a good portfolio, crest form signed, with some NHS experience? Is that all that they need? I think they're just trying to summarize everything that you gave in so much detail.
Yeah, I mean, it's a good question, definitely, but you need to be very much interested in internal medicine, I'd say, and that you would, if you are interested in internal medicine, it wouldn't be a big problem for you to get your crest form signed off, because the only challenges in the crest form are ALS and QIP. The other things you can easily achieve if you've got NHS experience. So yeah, also you have to perform well on the interview.
Thank you. Just on the crest form, because there's a new crest form that's been released for August 2024 entry. So please have a look at our blog regarding the crest form. The good news is that has been simplified. So now ALS is sort of covered in a different manner in the crest form, but it is a lot simpler now. Someone's asked, how important are research projects, and how many publications would you suggest is required to get into IMT? Bit of a difficult one to answer.
It is, but it's good that they have asked. It's not a definite criteria to have a research project to get into IMT. It will definitely give you good marks, a bit more marks for your interview, for your application, sorry, but it's not an essential criteria, and there's no number, no magical number for the research projects that you should have. Yeah.
And how difficult is it to get a post in London for IMT? Someone's put down like through CDF post. I don't know whether that means anything to you.
I'm not sure about that, but I think it should be a bit. Yeah, you should be having a good interview score and good pre-application score for London, I think. Yeah.
Okay. And is there any minimum work experience required for IMT?
I haven't heard of it. I have seen people applying even from their home countries and entering into IMT, but they struggle. I wouldn't recommend that. But you
Sure.
should have some experience of NHS.
Yeah. And I think somebody's asked, I don't know whether you know, but clinical development fellow posts, can someone enter IMT without training and go straight to consultant? I think that's a different pathway altogether.
Yes, it's a different pathway. I have seen a few people here coming through MTI pathway. I'm not really sure how it works, but there is something, and I think it would be a better idea to ask them, because they have got a lot of experience in their home country. They're like quite experienced consultants in their home country, and then they can get something signed. They all their competency signed off through GMC. GMC is happy, and the trust they're trying to apply for is happy. They can enter. I'm not sure as a consultant or as a medical registrar, but there's something. Yes.
Okay. And what's the best way to contact you, Natasha? I know you're very busy as it is. Somebody's asking if there's any way they can contact you to get further guidance.
I think Facebook is fine. Yeah.
Yeah, fab. Thank you so much, Natasha, for that insightful talk.
Thank you.
Especially,
it's a pleasure.
Thank you so much. We appreciate you taking out time on a Sunday. And yeah, lots of great comments coming through. So thank you so much for supporting so many people.
Thank you.
Once again, the same for me, Natasha. Thank you so much for jumping on again. And every year we see the talk, but each time it adds something new and some added value. So thank you for that, and have a good rest of the Sunday, and we'll catch up very soon.
Yeah, see you soon. Take care. Bye.
Thanks, Natasha.
Thank you.